A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. The U.S. is battling an opioid epidemic crisis with the overuse, abuse, and overdose deaths attributed to the class of drugs called opiates, opioids, since the 1990s. Now, according to the National Coalition Against Prescription Drug Abuse, NCAPDA, for the first time in U.S. history, there were over 100,000 overdose deaths in a 12-month period. Fentanyl is increasingly responsible for the growing number of these accidental overdoses, more than 67%. And last year, more than 300 people in Erie County died due to opioid-related deaths, a dramatic increase over the past 4 years. It's now more important than ever to know about the risk of contamination of street drugs, signs of an overdose, and to carry what's called Narcan. On this edition of Your Hometown Health Connection, we'll showcase how Spectrum Health and Human Services is responding to this crisis and about a medication-assisted treatment enhancement grant made possible by the Substance Abuse and Mental Health Services Administration that will provide vital resources, making a difference in our community. I'm John Di Sciullo. Welcome to our program. Let me introduce our guests from Spectrum Health and Human Services. Ann Bowback is the project director of the Medication Assisted Treatment Grant at Spectrum Health and Human Services, where she has worked for 23 years. Ann is a credentialed alcoholism and substance abuse advanced counselor with a specialty in gambling treatment. Cindy Hillman-Voelker is president and CEO of Spectrum Health and Human Services. Cindy has been at Spectrum for 37 years, initially as senior vice president and then as associate CEO. She has a nursing degree from UB, and her extensive experience with health organizations and hospitals, nonprofit organizations, and focusing on addiction and mental health have prepared her for leading one of Western New York's largest health and human services agencies. So welcome to the program, ladies. Your expertise is really going to help a lot of folks here in Western New York. We'll start, Cindy, with you. Spectrum Health, one of the largest agencies in Western New York. We just identified that, but 19 locations, kind of a 24-hour helpline that you offer with people in the community. Provide us with an overview of what Spectrum Health Services is all about.
Well, Spectrum is in its 50th year, so that's one of the things that we're celebrating this year. So we've been around for a long time. We provide services in Erie County, but also in multiple counties: Wyoming, Orleans, Niagara, Monroe, Wyoming. So we have a broad range of services that we provide. We do mostly community-based services and clinic-based services. So we have a certified community behavioral health center with multiple locations that provide drug and alcohol and mental health counseling and a lot of rehab services. We have assertive community teams that go into the community and help people with serious illnesses. We have a very large housing program that provides supportive housing to individuals with disabilities of mental illness and substance use. We have care coordination programs that help do case management. So we do a lot of community psychiatry, so to say, and a lot of addiction work in the community. So
you've seen a lot in your time there.
I have seen a lot.
Yeah,
yes.
And what's important is that you're in the community. You are where the people are.
Yes.
And
yes.
when people connect with Spectrum, is there a fee associated with the services at all? How does that work?
So you can get services whether you can afford to pay or not at Spectrum. That's one of the things that certain funding sources help us with. But we take all insurances, Medicaid, Medicare, sliding scale fee. So we have a lot of options for people, so we don't turn anybody away if they need help.
Very important. You don't want to turn anybody away. So
No.
if they feel
and
they
we
have
have
an
grants that also help support a lot of people.
That's right. We'll talk about that. So,
Yep.
and let's talk about some of the grants that have helped you. One of them, Substance Abuse and Mental Health Services Medication Assisted Treatment Grant, which sounds like a lot of words, but a very important piece
Yes.
for your effort. So I understand this is a collaboration between your agency and Evergreen Health. Give us a general overview of the grant and what's your role and what you do to administer that.
Well, the overall goal of the grant is to help reduce opioid-related deaths in our community. So it is a collaboration with Evergreen Health. And one of the things that we do is once a person gets enrolled in our services and they're identified as someone with an opiate use disorder who wants medication to help with that, we right away enroll them in our grant. We offer them peer services, and we get them linked with a prescriber right away, quick access to the medication. So our goal is to get them linked with a prescriber generally within 72 hours.
And how connected are you with some of these people that come through for these services? Because you've been there a while as well.
Well, I have been there a while, and some of the names are very familiar with me. I more or less oversee it, but I do reach out to clients when we're having a hard time getting a hold of them. Part of what we do with our goals, try and help people not fall through the cracks. A lot of times people will kind of fall out of treatment a little bit, miss a bunch of sessions, so we try and reach out and re-engage them. I'm also involved with people out in the community. We do a lot of community events where we do Narcan training, talk to people about our services, things like that.
And we'll show Narcan in the next segment, so you want to stick around for that.
Yeah.
The collaboration with Evergreen Health and other agencies, talk to me about how you collaborate with the people in Western New York and the other agencies in Western New York.
Well, with our grant, you know, we kind of share our resources. We work with other agencies at the community events. We partner a lot with Erie County Department of Health, who assists us in providing us Narcan. We also use other agencies as part of our referral sources and things like that. So I think we're all really one big community in this area, all trying to work together for the same goals.
Yeah, it seems like there's a lot of integration and a lot of collaboration. We talked about Narcan and the opioid epidemic, and earlier in the program we identified some statistics. Cindy, let's talk a little bit about the opioid epidemic in Western New York and across the nation, really. How is it here in our hometown?
Well, I think we like to say in some ways that it's the silent epidemic, that it's something that doesn't get as much discussion about, but that it is happening every day. So we've seen a lot of deaths. I think 2016 was the highest level of deaths. It started going down, but it had reached the highest peak. There was, you know, a lot of efforts in Erie County to bring together all the providers to kind of tackle this problem. We started seeing the numbers go down. Then comes the pandemic, the numbers go back up. So
I saw that in the report. They were going up, they went down 2020-ish.
Yeah, and now they're back up.
And they're back up. And it's, we talked a little bit in the conference room, not so much about the city versus suburbs. It's kind of a clear-cut piece.
I like to say, if you ask anybody that you know, do you know somebody or has anybody in your family or anybody that you know been affected by an overdose or opiate issue or death? Most people will say yes.
Yeah. So. Let's go back a little bit in time. We had done some shows here at WBBZ on opioid addiction going back maybe 7 or 8 years ago. It seemed like it was very much in headlines then. Was that when it was becoming more apparent? Has it always been around?
I think what happened is that was when the peak when fentanyl became known to cause such sudden death for people. And that was not something we expected, that we knew was going to happen. And so I think as soon as that started happening, there was so much awareness, because you could be suddenly, you know, find people suddenly dying with not really expecting that to happen from what the substances they were using. So it was kind of a shock to a lot of people at that point.
And let's talk about those substances. You know, we hear opioids. What is an opioid?
Well, an opioid is something that is prescribed or gotten on the street, that is a substance that is a controlled substance that is addictive.
Usually for pain medication.
Usually for pain medication, so that is why you would get prescribed. Heroin is also considered that as well, but you can also be prescribed heroin or not even know you've been given that in some health facility. So those are common drugs. They're given for those reasons, highly addictive, highly able to be abused at a certain point in time when people develop that.
And the concern with fentanyl, and feel free to both of you to jump in on this, but the fentanyl piece has become even more now part of the headlines, with it being, you know, we hear cut into cocaine, if I'm saying that properly, or just fentanyl in other substances. Why has fentanyl become such an issue? Where does it come from, and how do you know it's even in an illicit drug?
Well, you don't really know it's in your drugs. You should pretty much assume, if you didn't buy it from the pharmacy, it's probably in your drugs, which is why we offer test strips. Fentanyl is being really cut into most substance because it increases the high. It's cheap, so you have to use less of the other drug. So drug dealers cut it in. So a lot of people don't know they're getting it, which often results in the death.
I think the other thing that's happened is with cocaine, you know, it's not an opiate, it's a stimulant, and so people don't expect to be addicted in the same way. You're not turning to heroin, but fentanyl's in there, so you could, you know, use casual use of cocaine, be dead, you know, or close to that from that impact. So that's unusual.
Because there's maybe with people who abuse a false sense that it's not going to happen to me.
Right. Absolutely.
Yeah.
Right.
And this is something that they should be aware of if they're out there using it. And there's another drug, and I'm going to say the name, xylazine.
So xylazine is a drug that we're seeing in our community. It's a veterinary medication. It's often cut with fentanyl because fentanyl may last maybe 2 hours. With xylazine, it can last up to 6 to 8 hours. The risks associated with that is that, you know, someone uses xylazine, they're literally knocked out for 6 to 8 hours, placing themselves at risk for assault, robbery, compression wounds from like falling out maybe with their arms against something.
Right.
Yeah, we're seeing it here. I think there were, 12 opioid, xylazine-related deaths in 2022 in this community.
So that's something to be on the lookout for. And it does terrible things to your body from the photos that I saw in your report.
Yeah, it causes some really nasty wounds on people that are often away from the site of injections. So we're really telling our staff and our clients to kind of be on the lookout for wounds that you are maybe unexplained, and make sure you're keeping an eye on them and treating them before they get to that point.
Yeah. And methamphetamines. Let's talk about meth. And is it prevalent in Western New York?
It's prevalent, but not as much as it is in some parts of the country.
Yeah.
So we haven't seen kind of an epidemic of it, but it is a drug of choice of use that people can get into a lot of trouble with.
Yeah.
I don't know, Ann, if you want to add.
I think with our grant, we do kind of poll people, what have you used over the past 30 days? And I do think that we're seeing a little more meth than we used to. And certainly it's a very dangerous addictive stimulant.
Yeah, and as we talked earlier, I had done some programs with some other people from other parts of the country where it does seem to be spiking in much more, even in rural areas. Let's talk about harm reduction and what Spectrum does and what that means.
Well, harm reduction really has been something we've been looking at for quite a while, which is embracing people where they're at, trying to, you know, engage them in support, reducing the harm coming to them without, you know, the kind of like, you have to stop today, you have to turn your life around to this moment, and you got to go to rehab. I mean, what we try to do is like, let's take it one step at a time.
Yeah.
And, you know, reducing the ability to have being alone.
It's that, like Cindy said, it's that acknowledgement that, yes, we understand people are using substances, so let's talk about that and how can we make you safer. And things like Narcan, syringe exchange programs. We don't have safe injection sites here, but those are all things that are considered harm reduction
I believe
activities.
New York City started two. They were allowed to start 2 safe injection sites. There's a lot of controversy about whether or not we should move in that direction. But there are a lot of things, you know, needle exchanges, the ability to have Narcan in all the community, things that can save lives. So the harm reduction is save a life, try to avoid death, and then work to engage people and try to get them the help they need. Because underlying any addiction, there's usually a lot of other issues. You know, there's usually things that need to be addressed.
Before we go to break, what are some of the ages of the people that you deal with harm reduction or dealing with some of these issues overall?
It's all ages. Yeah, it's not anymore. I think when this initially came out, we were focused on the teenagers. No, it's everyone.
But education obviously important at
Very
the
important.
earliest of levels.
Well,
to talk
yeah,
about that.
earliest
Substance
of
abuse.
levels, but even to people like my age who might think they're immune, educate them on, because we're getting the prescription medications.
Right.
Everyone needs education.
And something we're going to talk about in the next segment is Narcan, what that's all about, administering it. And that will happen right after we come back as we continue after this brief break. Not one more. Western New York is urged to stand together to end overdoses. Spectrum Health and Human Services invites you to a free community event Wednesday, August 30th from 4 till 7 p.m. at Veterans Memorial Park behind 1250 Union Road in West Seneca, with resources from area treatment providers, free concerts featuring the Patty Parks Band, children's activities in the Mets Dance Studio, and more. Information is at shswny.org. Presented by 5 Star Bank, our partners at Channel 2, the Town of West Seneca, and West Seneca Chamber of Commerce. Welcome back to your Hometown Health Connection. We're talking with Ann Bowback and Cindy Hillman-Voelker of Spectrum Health and Human Services. And ladies, it might surprise people to know that opioids might be in their home, prescribed to help them, as we said earlier, with pain, but they may not need them anymore. They may not have needed them at all, to be honest with you. how do they dispose of them if they want to get rid of them safely?
Well, you have to dispose of them in a proper way. So there are, pharmacy.com can tell you where to go in your community. There's also, I think, different police stations and different pharmacies, but I think going to a central place online and looking to see where it closest to you is the best option.
Yeah, and just reminding people, don't keep them around for just in
Lock
case.
them up somewhere.
Yeah,
Until
because
you can get
somebody
rid of them.
might snoop.
Right.
Yes.
It could be even a family member that
Yep.
might secretly have an addiction. And,
Right.
and I'm sure some families may not even realize that.
Yeah.
Yeah. Let's talk a little bit about what the risk factors are for a person for overdose. What would cause an overdose? I mean, we talked about fentanyl and the reaction, but is it just ingesting too much of an illicit substance?
Well, people who would be at greater risk for overdose would be people who had maybe been substance users and had an extended period of abstinence, maybe people getting out of jail, people getting out of rehab, people who were abstinent and are relapsing. Also at risk would be, people, your first-time users who aren't aware of what they're using, people who buy from a different source and don't really know what they're getting, people who have health issues. What am I missing? Yeah.
So what would the signs be for an overdose? Not only for the individual who would be experiencing it, but from the bystander who would see somebody in distress going, what's wrong, that might be an overdose. What would you define that as?
I mean, somebody looking unconscious, falling down, falling out, just nodding out and then not able to arouse them.
Maybe turning blue, that not breathing, making that kind of horrible gurgling sound. Overdoses happen typically within the course of maybe 1 to 3 hours, so it is that kind of gradual sort of falling out.
I was just going to ask that, what the time frame would be from somebody that would ingest something to the time that they would start to overdose.
Yeah, it's kind of stereotypical that a person overdoses with a needle in their arm, although with the potency of fentanyl, that's a little more likely, but it is generally 1 to 3 hours. And, initially the person may be nodding out, but, you call their name, they can respond, things like that, but then slowly become unconscious.
Yeah. And we talked about overdosing and the Narcan and the connection that Narcan has with alleviating this overdose, or at least giving the person some relief. You have that on the table there.
Yeah.
Show us what the demonstration of Narcan would be and what it would look like.
Well, this is your box of Narcan, and it has 2 doses in this. And this is what we typically give away at events with the county. We get this from the county, and they give it away at events. So when someone is overdosing, it's that process. If I'm still conscious and you can rouse me, you wouldn't give me Narcan. If I was not responsive, you called my name, gave me a sternum rub, you told me you were giving me Narcan, and I didn't wake up, you would proceed to save my life.
So hold that close to you, Ann, and show us. So there it is. That's what it looks like when it comes out of the box, which may be now soon free at various pharmacies, I'm to understand.
Not free, but it would be available.
Be available.
Right.
So there it is. And how do you administer the Narcan?
Well, first, you always call 911. Just in case it's not an overdose or you need extra help, and you should always call 911. And then to administer it, you want to get the person on their back, kind of open their airway up, and then if you're trained in rescue breathing, give 2 short rescue breaths, and then proceed to give Narcan. So you would just take it out. This is 1 full dose. You would place it in their nostril, press it, it's done. You've given 1 dose.
Yeah, so let me have that.
Yeah.
So this is the Narcan.
Yeah.
And it would go in 1 nostril.
Right in. Your head's back.
And the receptors, I'm to understand, it does something to the brain and the connection.
It'll push the opiates off the mu receptors in your brain.
But if it doesn't work, you may need to do it again.
Not with that one.
Oh, you'd have to get another one. Okay.
There's 2 in a box.
There's 2 in a box.
Yeah,
okay.
2.
Interesting to know.
Yeah.
So 1 time,
Yes.
1 nostril. But if you have to do it a second time, you would need the second.
Yeah, so you do it 1 time. You got to give it time to work. So wait 2 to 3 minutes. If there's no response, the person hasn't started breathing yet, then give them the second dose in their other nostril.
Gotcha.
If you have to walk away for any reason, or that person starts to come around, you want to put them on their side in the rescue position, facing away from you in case they would get sick.
And if the breathing piece, it would be, the person would be tilted back and you would do something, would it be a mouth-to-mouth on the breathing?
If you feel comfortable in doing rescue breathing, yes, it would be mouth-to-mouth. Yeah.
And what is the person's reaction? Do they get physically ill after this is administered?
Yeah, if a person has a opiate dependency, they're likely going to be very sick, and most people are going to be confused, upset when they come around, and your goal is to keep them calm until the EMTs come, encourage them not to use another substance because it's not going to work. There's Narcan in their system, and then the likelihood of them going back into overdose after that wears off in about 30 to 90 minutes would be higher.
Yeah. We talked earlier, Cindy, about people who get connected to help, and the level of anonymity might be very important to people because of the stigma involved with their overdosing, they're doing drugs, they don't want a family member to know, but they need to get better. There's something called the Good Samaritan Law. What does that mean?
Well, the Good Samaritan Law has actually been around for a while. I think it was the late 80s maybe when it was passed in New York State. But you're basically immune from any legal action, any liability, anything to do with drugs or anything. You're immune from all that. You can get no trouble for that or anything that happens to an individual for reporting it to the police or for helping them. So I think there's a lot of security knowing that you can do that without any consequences.
That's
legally.
important to know, because if somebody is going through something like this, they may all of a sudden realize their cover's blown and it's
Right.
out there for the world to see. So if that
Yeah.
individual's helping them,
Yes.
they
Even if you're underage, even if you're having substance there's no legal consequences to that.
Yeah. It does cover only the person that called and the person that's overdosing. And it doesn't cover if you have like an outstanding warrant or more than 8 ounces of a controlled substance. But like Cindy said, it protects the person. People didn't call because they were afraid of getting arrested, so they just left people there to die.
Oof, that
Yeah.
would be awful.
Yeah.
You'd rather go through the
Right.
Good Samaritan Law than know
Right.
that another
Yeah.
human being will be scarred or dead.
Yeah.
So you just gave me some training in
Yeah.
Narcan, and I know now what to do
Right.
if somebody is in need. Talk to us about how people would be trained as responders and what you do in that level and what New York Matters means to that.
Well, anyone who comes to any of our events or even the county events can get trained on how to be a opiate overdose responder. It only takes a few minutes to get trained, as you could see. Also, the county offers online trainings. I don't know, I looked online this morning. I think there were like 2 a week all through August. So you can go online, get training that way. And New York Matters is a great resource that we use all the time. So New York Matters links people up to start medication for an opiate use disorder like Suboxone same day. If I came to Spectrum and I can't get you a doctor appointment till Friday, today's Tuesday, you want to start medication today, I can have you download the New York Matters app, you set up a telehealth session, you get your medication today. It's a really great resource.
Cindy, we talked about some of the things here to help people getting out of their issue with Narcan. How do you help people at Spectrum recover in the sense, we talked some earlier about success stories, where they completely kick their addictive behavior?
Well, it's a process, and I think the first thing you do now, what we do is get somebody in, if they're eligible to get a medication-assisted treatment to help them through that. We get that quickly. We try to avoid as many hoops as possible you have to jump through, and we try to be there. Then you just have to start working a recovery plan, getting peer support in place, getting self-help, then looking at are there other underlying conditions, depression, anxiety, are there other things going on in their life, past trauma. So we kind of approach it from a lot of different angles and then develop a recovery plan.
I think you covered it, but
Yeah.
one of the other things too, helping people recover, is that acknowledgement that the goals have to be theirs,
Right.
not ours anymore.
And I hear about triggers sometimes
Yeah.
when people kind of
Yes.
feel like they've beaten it, and then something happens in their life, or there's something that triggers it back.
Yeah, and you don't, one slip up and going back doesn't stop your recovery plan.
Right.
You just go back and you keep going. And we hire a lot of individuals in our agency, and so do a lot of our other agencies we work with, who've been through this themselves, who are peers or who have had recovery and they understand it completely.
So they themselves have gone through
Yes.
recovery.
Yep.
So that peer-to-peer piece
Is
becomes
very-
even more
it's very
relevant because
important.
they've lived it.
Yep.
Yeah.
And they can see, here I am. I'm working for Spectrum. I've turned my life around. I wouldn't go back to that, but how do I get there?
We've talked
So-
sometimes in other shows about the stigma of mental health, and I would think the stigma here too is in place. You don't want people to not reach out to you or these other agencies. If they feel they have the need, they should reach out.
Yeah.
Reach out. Education, reach out, get help, get support, talk to somebody, do something,
Yeah.
right? You know?
And you feel the same way, I would think. yeah.
Absolutely. Reach out, get started right away.
And maybe from family, gets the support from the family. You know, sometimes you hear about the family kind of pushing that person out because they feel like they're an addict. Can't do that.
It's very stressful for families,
Yes.
but I think that you need to support the families as well, but there's a lot of dynamics that go on, and I think
everybody's
that's part
different.
of recovery as well,
Yeah.
how to help everybody heal from it.
Yeah.
Well, we have some important phone numbers we're going to talk about here. First of all, we talked about New York Matters, which is 765 Matters, the word, which in numerals is 765-628-8377. There's an email there as well, info@mattersnetwork.org. We'll have all this information on the screen and at Buffalo Healthy Living. And Spectrum Health Cares, that phone number 24/7, Spectrum Health, 716-882-4357, 716-882-4357, and 24 hours, Cindy, that people can...
Yes, we have somebody answering phones 24/7. We do outreach visits if it's needed. We work with crisis services if there's more need. So we respond also to kids and families and teenagers as well. So there's a lot of resources. I think 24/7. You can call a number, somebody will talk to you.
Right. I feel very connected right now, just talking to you and knowing that that is out there. Really appreciate that. So Cindy Voelker, President of Spectrum Human Health and Human Services, and Ann Bowback, thank you for all the work that you do there as well. And this was an important conversation. Stay with us. We have some more life-saving contact information. But thank you, ladies, for joining us.
Thank you.
Great.
Now, here is more information. If you're watching online from anywhere across the nation or even in Western New York, there's a 24/7 national addiction helpline, and that's 1-800-662-HELP or 1-800-662-4357. Now, you can also find out more about Spectrum Health and Human Services medication-assisted treatment program for the right combination of medication and counseling to help you recover from opioid addiction today. And this is the website for Spectrum, shswny.org, shswny.org, or that phone number, 716-539-5500 to start your recovery journey. I'm John Di Sciullo. Thanks for watching. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.